Today we're going to be talking about our topic, how Corona affected the economy and the different ways in which it did affect it. So my name's Jonathan Sanchez.
I'm Isabel Tijerina-Gonzales.
My name is Nataly Ramirez.
And I'm Lesley Martinez.
So as I repeated, our topic is how Corona affected the economy. And tonight we're going to be talking about the different ways in which it did. And I'll be explaining our table of contents. So first we'll start with the origin, give a timeline of the events that we think happened that were most notable. After that, we're going to list a various number of effects that came from Corona. After that, we'll talk about how those effects affected the economy and different stores, different businesses. We'll give a few examples of those businesses, and then after that, we'll give a prediction of what the future will look like for the economy.
So the timeline, it's the first known case was December 31st, 2019. Then it became an international concern January 30th. And then by February 11th, the corona officially was named the COVID-19. Then in March 2020, most of the US was in global lockdown, and Houston didn't start till about March 22nd.
So for the COVID-19 origins, the first impression isn't exactly what you would think, and the fake news makes it hard for the average person to get the correct information. There's been many stories and fake news out there that we really don't know at this point where it actually started. But a quote from CNN, scientists have banded together across international borders to commend the nationalist trigger conspiracy theories, and yet they have divided on what was once widely thought the most likely rupture, a so-called wet market in Wuhan, where wild animals are kept in cages and sold as pets or food. It's believed that the infected animal perhaps infected the first human. So there actually has been many stories starting off with that specific one, that it actually came from a bat. So based on many sources, the truth regarding the origins of the virus remain very elusive at this point.
So when it mentioned the pangolin, it's like an anteater kind of, and they said it was because it was being trafficked by humans and it went through so many countries and had so much exposure that was another animal that was like the main reason that the virus came to be, and that was actually debunked, saying that like the virus didn't come from that kind of animal at all. They just saw a similar strand that came from there. So just another proof to point that they don't know where the origins came from, but there's a lot of theories, but they do know that it came from a bat.
Another theory I heard was that it was created in a lab, or it wasn't supposed to come out of.
How did COVID-19 spread? Data has shown that from inception of the virus being discovered, it was only transmittable through close contact in China. So that's where it originally came from. Also, when this was discovered in a number of areas in China, began the lockdown procedures. Whenever it was discovered, China immediately started a lockdown, and that's how they reduced cases from increasing, because they all decided to stay home and not leave their houses. A lack of collaboration between countries and cooperations by not only its citizens but their tourists while air traffic was at normal capacity. The virus spreads was then announced to spread through respiratory droplets released when someone infected with the virus coughs, sneezes, or talks, which came with a huge effect of change.
So to add to that too, when China started shutting down, it was already pretty much too late. It was like a 2 week. So when there was already a huge number of infected people, it turns out that that was like twice or three times the number, because like who touched who infected who, and it really quickly became like, oh, we don't even have room for all of these people. So I'll talk about some of the efforts that they used to contain COVID. Um, as we just talked about in the last slide, China soon rushed themselves into a lockdown and advised like a stay at home, which severely impacted their economy. It was a halt on everything. Um, the hospitals soon like ran out of space. They were having trouble figuring out how to treat everybody because there was just no space. There was not enough medical equipment. There still isn't a cure, so that was the biggest thing too. Like if they don't have a chance to find a recovery for somebody, they don't have that option to free that room for somebody else. So quickly it became just like really mass hysteria. But that was China. Italy shut down half of their cities, half of their, areas, all that stuff. So there was a lot of different ways that they did it, but non-essential businesses in the US shut down. A lot of lockdown orders happened throughout the United States. A lot of non-essential businesses essentially closed their doors for some of them indefinitely, some of them just temporarily, but mass hysteria really took over the US as soon as it hit here. It wasn't serious until it hit here for us.
Some efforts on the economy. Many businesses had to close or reduce their staff due to the pandemic. The Small Business Administration has a plan to help small business owners. Millions of dollars are constantly being loaned out to all kinds of businesses to sustain their business. Businesses around the world were not ready for the effect that this could have. As things progress, the value of the dollar will slowly begin to plummet. This is being compared than the worst of the 2008 market crash.
Yeah, the value of the dollar is really really going to suffer. There's no stimulation in the dollar, and money's just being printed out to help out businesses, um, to help out people, like the People Care Act, giving people that stimulus check, and then trying to still give people more money. It's the value of the dollar is really going to crash.
Also, to add on to that, definitely another thing that's being affected by this is immigration. So the travel restrictions that they have put out already stopped, of course, immigration at this time. Despite objections from refugee advocates, the border has also closed the asylum for seekers. Restrictions of like weeks or 2 months will lead to a backlog of immigration cases as the economy works through its recovery. Governments may have to face some pressure to limit the total flow of immigrants actually coming into the U.S. Also, to mention the fact that the stimulation checks, that will also affect a lot of the people that are in the U.S. right now as immigrants, because they're not receiving that stimulation checks as the other people are.
So the Small Business Administration came out with a plan to help the small businesses in a form of a paycheck protection program. It has set aside $350 billion in relief money. Small businesses with employees up to 500 can qualify for the PPP. And if the relief money is in form of a loan, but if the funding is used properly, it can be forgiven. The funding is 2.5 times of your monthly salary of your employees. Also, if the money is not used properly, it will convert into a loan with the 1% interest rate. It's deferred for 6 months, and it's at a 2-year term.
So that's kind of like the small business loans that they're offering. People that can't do unemployment, like say they're self-employed and stuff, it's essentially a loan for like small businesses under 50 people. It's like up to 10 million. And then if it's, I want to say 100 or 200 more, they can offer up to $50 million in a loan. But it's a loan, so it's like they'll forgive so much of it, and then the rest that they don't, they give you like a 10-year period with a locked in 4% interest rate. But it's pretty similar to that, I would think, too. Just another way to like keep the stimulus, keep the finance, keep the economy booming, like keep money moving throughout it.
Some of the habits that have changed, at least for me, and I'm guessing for everybody as well, is whenever you go to the store. A few stores that are still open right now have drastically changed in the way of their procedures. Um, for example, now when I go to Walmart, it's now like you just get your card and you just simply go in. It's you would have to wait in a line to make sure that the worker spray down your cart, and then not only they look to see if you have your gloves on and also your mask, um, and then also some other things such as the store hours. They've changed the customer traffic. They're only able to see so many people out so at a certain time throughout the day, and of course the product demand also has been affected by that.
For me, working at a bank, we have to close down our lobby, and we're doing strictly motor bank, and we're trying our best to service our customers as well. So that's something different that has changed, and we're practicing social distancing. So we have 2 different shifts to make sure there's no more than 10 of us in there, and we have to stay our 6 feet apart.
I know.
Also
Oh, go ahead.
to add on, I work in a healthcare center. I work in a clinic. At this time, not only are we checking the patients to make sure they have like the main 3 symptoms, which would be high fever, a cough, or shortness of breath within the last month, they're also doing this to all of the employees. So as soon as you even get into the building, the first thing that we do is check for those 3 things. I feel like that's going to be for all over, especially in the hospitals now. They're really changing their ways of who they can see and who's important at this time because of the coronavirus going on.
I noticed that like in my business, I'm an OSHA inspector for fall protection, so I go to like a number of different places. But most of our work has like come to a complete halt because of the shutdown. They don't want third-party contractors coming in. They don't want people that have to travel and go through an airport to like risk all that just to come to their business and potentially risk their employees. So being like completely on the opposite end of the spectrum from like money or even healthcare, like it's affecting all kinds of businesses. Even right now, we're working at an Amazon, and to get into the Amazon, you have to go through a huge line where they give you gloves, a mask, and you have to be 6 feet apart from everybody. And then once you get into the building, they scan you like your temperature just before you get in, and if you fail, you can't go in. So a lot of differences have happened in the last couple of months.
Future economical economical predictions. So the economy is gonna take about 2 years to fully recover from this economical crisis. It could take longer, it could take less. It just all depends if the scientists or the doctors even find a vaccination or a cure for this virus. The price of the oil has plummeted to the lowest it has ever been in history, to below $0, bouncing back from 20 to $60 negative, according to Bloomberg National. The entire healthcare systems are considered filing for bankruptcy because of the lack of elective surgeries that came with the COVID-19. And China may never recover financially from this year's financial. Another thing that's going on is also immigration laws may change and be effective for several years to come. They could get stricter, especially for people who want to come to this side. And with all this going on, it's going to be harder for them. The national debt will severely rise. So I just feel like it might take a while for us to get back to how things were to normal, especially the small business. It may take them longer, or they might not even be able to come back up after this crisis. And things are going to change drastically, like the stores, they might remain like following the same procedures, so we won't be able to go back to like having to be afraid of the virus. A lot of things are going to change, and I don't think anything might go back to normal because everybody's going to be scared of this virus.
Like I had mentioned that I worked for a healthcare center. We actually suffered a lot because of the Governor Abbott's order that he placed on March 22nd. No elective surgeries can be performed. My company, or at least my nonprofit organization for the clinic that I work with, we had to let go over 100 people that work with us. There was only 47 of us working at that time. There were no surgeries that we can perform that was bringing our profit in. So we had to let go so many people, and we were literally at the limit where we would actually gonna go towards bankruptcy. But because of those loans that we mentioned earlier in the presentation, that actually saved our clinic at this time. So we're bringing back those employees that we let go of. So hopefully the future isn't as bad as we think it might be, but slowly but surely, I guess we're working towards making it a little bit better in this bad situation.
Right. So to summarize, we'll come and finish this now. Uh, there's a lot of work that's going to come from recovering from this, and the nation will be okay since we're already in a national debt. It's not like things are going to come to a halt, but unemployment's definitely going to rise. The debt's going to rise if things continue this way. But in the long haul, I think it's best that we consider an option like China, where we fully lock down and just kind of figure out what's the best way to recover from an infection like Corona. Because if not, it's like taking a pause every 6 months, and then the waves just come and crash our economy all over again. So it's like, sure, you're going to fight the fight for a couple of months, and then what happens when the next wave comes in? So I think ideally, a shutdown would really save the economy in the future. If anybody else, anything else to add, we'll end it after that. Okay, so this was our topic. Thank you for your time. Thanks.